leading cause of whooping cough, Bordetella pertussis, whooping cough, pertussis vaccine, and current problem with Bordetella pertussis is the outline of this lecture. Bordetella pertussis basics: aerobic gram-negative coccobacilli, belong to the family Alcaliginaceae, specific to human. This bacteria can cause whooping cough only in a human, not infected any other animals. Colonize the respiratory tract and lead to pertussis or whooping cough. This bacteria infect only human because of the receptor of this bacteria is present only in a human, not in other animals. This disease is very contagious and transmission occurs through the respiratory droplets. This bacteria has many virulence factors important for initiation and causing of infection. The virulence factor is divided into several groups: antigen and toxin. Antigens including filamentous hemagglutinin, pertactin, and fibrin. Presence on the surface of this bacteria and help in the attachment of the surface of respiratory epithelial cells. Toxins including pertussis toxin, which act as also adhesive factor and has a toxic activity. Adenylate cyclase toxin lead to formation of oedema and formation of cyclic AMP inside the cells. The tracheal cytotoxin, dermonocrotic toxin, and heat lapile toxin. When see of this bacteria represent a manufacturer for virulence factors and toxins, so that this is usually become severe. Pertussis toxin, colonizing factor, and has endotoxin activity, cell-bound and extracellular presence. Adenylate cyclase toxin has invasive activity, activated by host cell called modulin and impairment of immune effector cells. This toxin can be considered as immune escaping factor. يعني يساعد بالتهرب من الاستجابة المناعية للمرض. Whooping cough, also known as pertussis outbreaks, first described in the 16th century, major cause of childhood fatality prior to vaccination. A clinical feature of disease, an incubation period about 4 to 21 days, and the disease can be divided into 3 stages. First stage, catarrhal stage, about or last for 1 to 2 weeks. The second stage is paroxysmal stage, 1 to 6 weeks, and convalescent stage for weeks and maybe extended to months. اكو سؤال شباب لغاية الآن؟ اكو سؤال؟
واضحة دكتور.
واضحة إن شاء الله. ماشي. For diagnosis of this disease or this bacteria, we can be used several techniques. The most important is isolation by culture technique. This is a gold standard method for diagnosis of this bacteria, followed by using PCR, polymerase chain reaction, for detection of specific DNA pieces for this bacteria. This is highly sensitive and specific test. Also can be used direct fluorescent antibody for detection of the bacteria in sputum and using of serological tests such as ELISA or hemagglutination. Now, treatment of this bacteria, antibiotic therapy after culture. The most important, we down antibiotic susceptibility test for detection of this bacteria and detection what the most suitable antibiotic for treatment of infection. But we can use erythromycin, azithromycin, and clarithromycin in treatment of this infection. All these antibiotics belong to the class of macrolides of antibiotics. This is vaccine. First pertussis vaccine is a whole cells. يعني استخدموا البكتيريا بصورة كاملة كأنتيجين. يعني مو مثلا على سبيل المثال الهيباتيتس بي فيروس نستخدم سب يونت فاكسين اللي هو استخدام HBS انتيجين او مثل كلوستريديوم تيتاني we used تيتانس توكسين. هنا لا نستخدم شنو الهول سيلز البكتيريا بالكامل استخدموها ك vaccine. Or also now we use a cellular vaccine now used widely. Also can be used combination vaccine. So this is composed from diphtheria, tetanus, toxoid, and pertussis toxin for immunization of children around the world. Strain variation is very important change that lead to inactive vaccination. When the presence of a new strain, this may lead to failure in the vaccination. Bordetella Pertussis population has changed significantly since vaccine introduction. Also, by adaptation to vaccine, this lead to appearance of a new strain variant or lead to antigenic variation or divergency. This antigen make the antibody that produced by stimulation of toxoid. This antibody is become non-active against a new strain. Vaccine problem including complication such as allergy or failure, multiple administration, waning adolescent and adult immunity, and strain variability. Strain variability make the toxin is non-active. When immunized persons infected with a new variant or a new strain, this lead to appearance of the disease in different stage. شباب اكو سؤال؟
لا دكتور واضح.
واضحة المحاضرة. طبعا احنا ارتئينا انه نعطيكم هذه البكتيريا فقط اليوم، يعني ما نريد شوية نتوسع بالموضوع مالتها. اريد اركز على قضية الريبورتس شباب. قضية الريبورتس مو تنسوها ان شاء الله. اخر موعد قلنا يوم الخميس تسلموها